The following program is being brought to you on the Voice America Health and Wellness Channel. For more information about our network and to check our additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Good morning. Welcome to The Blood Detective, Finding Healing Solutions Naturally with Dr. Michael Wald. This will be a very informative look at your health, and we invite you to participate in today's show in a variety of ways. Now, here's Dr. Michael Wald.
Hello, everyone, and welcome to The Blood Detective, Finding Healing Solutions Naturally. And I'm your host, Dr. Michael Wald, and today's show topic is attack on alternative medicine. Now, what I'll attempt to do during the next hour is to present what I think is an honest perspective on some of the issues and problems that certainly exist between traditional medical doctors, that's your standard allopathic physician, and alternative healthcare providers, otherwise known as holistic healthcare providers, and also between the patient, obviously the most important component of the entire healthcare relationship. You know, as a clinician on a daily basis, I am faced with the frustration and upsets and lack of results experienced by many individuals who have sought out what they believe to be good medical care, and I think actually is good medical care, but nonetheless they're dissatisfied. And they come to me and they have what I think are legitimate issues in terms of perspectives they've learned from their physicians and wanting more and not getting it from their allopathic doctors. So I want to address that. And of course, because this is my radio show, you'll be receiving my personal perspective on things. I think, after all, that's the only way I can draw from experience. I don't think there's quite a purely objective way at looking at this. So today's topic will focus on my experiences and take from it what you will. And keeping in mind that this show, like all of the Blood Detective shows, is archived, you can also download the shows directly from our website at www.intmedny.com, or you can call us for an article on the topic at 914-242-8844. You know, I think healthcare reform needs to start with the healthcare provider and all the people behind the scenes, including politicians, because if we reinvent the system but have practitioners, healthcare providers that work within a broken system, we'll still have broken healthcare. So let's talk about the conflicts and confusion that again, I have seen between patients and practitioners. I think they're very deep. They go on many different levels, and they are affecting these issues, the very quality of our lives, and that's what it comes down to. So we're talking about you, your children, your loved ones. We are the ones that will suffer from this broken communication and what I believe is a lack of understanding between patient and their practitioners. The dynamics of the patient relationship with their allopathic doctor, I think, shares many characteristics of an abusive, one-sided relationship. And that deeply concerns me. Now, am I saying that your allopathic doctor is being abusive? Well, no. What I am saying is that there are instances where you're not listened to, where your opinions are shut off, where you're told what to do, and that's the way it's going to be, etc. We'll explore this more later. And those are characteristics of a limited and perhaps even an abusive relationship. Now, that relationship might also exist with your non-medical doctor or your naturally oriented practitioner as well. So wherever you might be receiving that limited relationship, you might want to reassess it. If you can't fix it, well, then you leave the relationship. So I will attempt to be fair during this conversation. Do you know, let's start with some glaring facts. the annual causes of death in the United States, because this is about life, and it's about quality of life. But we know that the leading cause of death right now is probably tobacco smoke. We've got roughly 435,000 deaths a year from that. Deaths related to poor diet and physical inactivity, about 365,000. Alcohol, 85,000. Microbial agents, 75,000. Toxic agents, 55,000. Adverse drug reactions, to prescription medications, 32,000. And I promise you these are underestimates. We've got a serious issue on our hand when adverse drug reactions is in the top 10 of the killers in the United States and causes of death. 425 million visits to holistic practitioners occurred in 1990, more than the total number of visits to primary care physicians during that same period of time. A follow-up study showed that in 1990, 34% of people visited alternative healthcare practitioners, and that increased between 1990 and 1997 to 42%. By 2001, hospitals started for the very first time to offer alternative healthcare therapies. Now, did we have a sudden discovery of scientific evidence? No. What happened was people demanded it, and hospitals saw financial interest, and they started to offer alternative therapies. So you must believe what you probably already knew, that you as the healthcare consumer drive the very direction of how the healthcare industry, and I use that term loosely, healthcare industry, it's more of a disease care industry, goes. Why don't I start, first of all, with some definitions. I've thrown around a few already. Complementary medicine is one of them, and that basically means that it complements, or this approach to healthcare uses many different tools and uses them together. And then there's alternative medicine, and that obviously implies that there's something used in place of conventional medicine. And then there is holistic medicine, which implies to me that there are many aspects to the individual and therefore the healing process, considering the structural and the emotional and the mental and the energetic and the biochemical and the nutritional. All of these things are considered together. And the term I like the best, actually, is integrated, because it implies, or at least it's not alternative, meaning other than. It says, well, whatever works, let's just integrate it together if it works. And it's not quite saying what complementary says, which says, using it all together. You can use things all together, but that doesn't mean they're integrated in a way that fits the individual. So once again, I personally like the term integrated. And natural healthcare practitioners, I think, misses the mark, too, for many practitioners, because it implies that you can't use anything other than what's natural. So there are things that are unnatural, which at least I believe are worthwhile using. We talk about natural hormones, but there are no natural hormones. There are no hormones in plants. There are chemicals in plants that look like hormones that can be turned into hormones in a laboratory. We call them bioidentical hormones. So those are not natural, but those might be good for people. So hence the name of my clinic is Integrated Medicine and Nutrition. I like the word integration. Now, a large-scale study published in the Journal of the American Medical Association found that complementary medicine use among the general public is growing exponentially. A larger study in the Journal of Clinical Oncology, that's a cancer journal, found that 69% of patients that they looked at with cancer in this study used some form of treatment. It seems that the sicker or the more horrific the condition, the more people tend to gravitate towards alternative, holistic, or integrated healthcare. And forgive me, I will alternate between these terms for the purpose of the show today. Now, there are some statistics based on a study performed in 2004 by the Center of Disease Control and the U.S. Department of Health and Human Services and the National Center for Health Statistics. And it shows, this report was actually based on 31,044 interviews of adults 18 years and older in the United States, and they found that 62% of adults use complementary and alternative medicine. 36% use some form of these therapies during the past 12 months, and that's excluding prayer, by the way, which is strangely enough considered an alternative therapy in some of these studies. There's a high rate of use, which translates into lots of money out of pocket. Why would intelligent people spend money for health care when they could go to their doctors and have it paid under their insurance? Well, we'll see about that in a little while. Now, what are some of the reasons why we see such an exponential increase in growth of alternative therapies, like I've just explained? Well, some research suggests that it's market forces. You know, this stuff is available on the internet and it's in the news, so people see it and they start using it. There's also the theory that there's a desire of people to be actively involved in their medical decision-making. Well, that's a novel idea. They seem to be dissatisfied with conventional therapies. They have found sometimes that there's an inability of conventional medicine to treat their chronic disease. So these all sound reasonable to me. So people want alternatives. As I mentioned, there's an exceptionally high use of alternative therapy for people with life-threatening disease. Unfortunately, I believe people discover the benefits, the potential benefits of alternative medicine or integrative therapies sometimes when it's too late. But still, studies show that it can be extremely useful for even late-stage diseases such as HIV and even cancer. So in my experience, people have this innate knowing. They just believe, and probably also based on their education, that medical physicians should not make all of their healthcare choices, and they should not impose their ignorance in integrated medicine when people are seeking them for advice and expect an unbiased opinion. These are just communications between myself and patients. This is what they're telling me is the problem. My patients seem to be attracted to the basic philosophy of integrated medicine, where it involves a large number of methodologies that are relatively safe, used at the same time as they should be, given the holistic concept, and the concept of maximizing the body's inherent ability to heal and considering the whole person, addressing the physical, the mental, the spiritual, the chemical, and all these different aspects of what it is to be a human being. You know, one thing I will explore before the commercial is that some patients have said to me that, my doctor's told me that complementary medicine is nonsense. And then they told me that the FDA banned ephedra, which is this herb, by the way. And yes, it's true. The U.S. Department of Health and Human Services banned the sale of ephedra in 2003 because of risks associated with it. And these physicians tell these patients that we don't know these interactions and how these herbal and vitamin therapies interact with medications. Well, a good integrated medicine practitioner does know these things, and risks are real. But some drugs have been withdrawn from the market because of risks to patients as well. Thalidomide, for example, in the 50s, very highly teratogenic. Diethylstilbestrol, they found out in the 70s, was withdrawn, first of all, from the market because of its cancer-causing potential. Phenacetin, another medication in 83, was withdrawn because of the risk of cancer and kidney disease. Meridol in 1986 because of the risk of hemolytic anemia. Seldane, we could go on and on and on with the many, many hundreds of examples of dangerous medications, but it seems that the doctors come up with one or two herbs. After the break, we're going to continue this discussion, attack on alternative medicine. So I invite you and physicians listening to call in. Please challenge me or send your emails along, and we'll integrate them into the show. We'll see you in just a few seconds. Thanks.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
Tune into the Voice America Variety channel on the Voice America Talk Radio Network. Voice America Variety broadcasts a diverse array of topics reaching a global community. Our experts come from all walks of life, and the topics they discuss are everything from current events, arts and entertainment, leadership, parenting, relationships, self-improvement, career advice, and a variety of other topics. Check us out today. You're sure to find something of interest. Voice America Variety. Talk on today's hot topics.
Step into the doorway to conscious choice, greater health, and well-being. Attain the balance that you've been seeking. tune in and turn on 1111 Talk Radio. Feed the mind. Embrace positively. Release the tension. Step out of fear. Host Simran Singh will help you broaden your mind and open your heart toward a greater understanding of how to take charge of your life. 1111 Talk Radio is here every Thursday at 7 p.m. Eastern Time, 4 p.m. Pacific Time on 7th Wave Network. 1111 Talk Radio, because shift happens.
Are you frustrated with your doctor's lack of thoroughness investigating your health concerns? Are you surprised that they often say, your blood work is normal, and then give up investigating your health issues? Or worse, they offer you medications instead of answers. If this sounds familiar, then you should know about Dr. Michael Wald's Blood Detective technology. Send your blood and other test results to BloodLogic, and you'll receive a detailed report of all of your tests with a complete description of their potential meaning, both medically and nutritionally. Dietary and nutritional supplement advice is also included. Dr. Wald himself will personally provide you with his personal opinion of your test results if you request it. For more information about your BloodLogic report, go to www.blooddetective.com or call 914-666-2943. Start getting answers today. Again, visit blooddetective.com or call 914-666-2943.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You're listening to The Blood Detective, Finding Healing Solutions Naturally with Dr. Michael Wald. To be a part of today's discussion, please call in toll-free at 1-866-472-5792. That's 1-866-472-5792. Or send an email to info@intmedny.com. Speak up. Dr. Wald wants to hear your question. Now, back to The Blood Detective.
Welcome back, everyone. This is Dr. Michael Wald, and thanks for tuning in to today's topic, attack on alternative medicine. And obviously, as an alternative healthcare provider or complementary healthcare provider, this topic concerns me. It concerns me because I have many frustrated patients that do not understand how intelligent healthcare providers, such as their medical physicians, do not seem to understand the fundamentals of alternative medicine, and in many cases either ignore the patient's desire to discuss the issue or get outright offended by it. So I think that today's topic will go over many of the basics, in my mind, that explain this reaction and will help you navigate through your healthcare decisions, because that's really what it's all about. This is not a conversation to develop an anti-MD attitude, not at all. It's rather to help develop mental tools on your behalf so that you can distinguish between bias or prejudice or just lack of knowledge or just opinion from your physicians as just opinion and not the sacred cow of conclusions. Okay, your medical physician does not know everything. And neither, by the way, does your alternative healthcare provider. So before the break, we spoke briefly about one of the criticisms of natural medicine, and that relates to the quality of the nutrients being given and dangers. Well, governmental statistics are available on toxicity and adverse reactions to not only medications but also to nutrients. And if you compare the two, there is no comparison. The level of safety of nutritional supplements is far, far better. There's a much lower response in terms of adverse reactions to nutrients than there are medications. And then the issue of quality comes up. And I said before the break that, yes, there are quality issues with nutrients at times. That's why you need to go to a reliable healthcare provider. And we'll talk about what that is later, that you can trust to choose the best companies for you. You can't rely on what you hear on TV or what you might read in a magazine you get in the mail. You really have to go to someone you trust and ask for the proper paperwork on the nutrients that they suggest to you. And then I listed many examples of medications that had FDA approval but killed many hundreds of thousands of people over time. So we need to be fair in terms of that conversation. So who uses alternative medicine, first of all? For what health purposes? Well, I mentioned that approximately 50% of those with cancer, according to various surveys, use some form of alternative medicine. And also there's a very large use among people with fibromyalgia and chronic fatigue syndrome, head and backache, chest colds, joint pain, anxiety, depression, different types of arthritis or arthritis, intestinal problems, severe headaches or migraines, insomnia, sinusitis, high cholesterol, asthma, hypertension, menopause. These are some of the conditions that surveys have shown that you go to alternative Medicare providers for, which means you're not getting the type of relief you want from your regular physicians. I think that not all the people who seek out alternative medicine providers and say they get well are making it up. I actually think that it works. Does integrated or alternative or holistic medicine work for everyone? Of course not, but neither does medicine. So that's why I personally like to practice integrated techniques where we take the best of medicine and the best of nutrition and see how that works for each individual. Now, some other criticisms I've heard from patients is that alternative medicine is not even worth researching because it's just fundamentally unscientific, and these physicians seem to relate to the patients, at least, that the approaches in natural medicine are unproven, they're implausible, but the public disagrees. Not only does the public disagree, but so does science. If one were to search what's called the Cochrane database or PubMed, Published Medical Articles.com, that's the National Library of Medicine. This is where doctors go for research. And you search cancer nutrition, as I did yesterday, you will come up with 16,642 studies on the use of cancer nutrition. You'll come up with 11,168 studies on diabetes and nutrition. If you search autoimmune disease and nutrition, you'll have 2,041 studies. Obesity and nutrition, over 13,000 studies, and the list goes on and on. I dare you to search complementary medicine, and you'll get 157,111 studies. And that's just based on a basic search. There are different types and ways of searching. The idea here is that this is being looked at. This is being studied. There are plenty of studies, and many of them, and much of this study, is extremely, extremely positive. So I don't understand this conversation of lack of evidence. I really believe one of two things are happening. One, that the physician, the medical physician who is saying there is no evidence, really believes there is no evidence, but on the other hand has not searched and is saying something that they don't know to be true. And I think that's misleading, whether it is intentional or not. Now, I sometimes will say that to a patient, and they will quickly say, oh, but my doctor's so busy. And I look at them and I kindly say, well, I can appreciate your doctor's busy. We're busy too. We're all busy. We have busy lives. But too busy for your health, that's what you hire us for. So if someone comes to an alternative healthcare provider and they need a non-alternative healthcare provider, should we say that that provider is too busy to know the difference? I don't think so. All of us involved in healthcare need to know our scope of practice and need to know our limitations, and not to simply say that something is true or not true without any knowledge. So that to me is a lie, and that is inexcusable. So to reiterate a couple of things, what type of alternative therapies are actually being used? Well, it seems that chiropractic therapy is extremely popular, yoga very popular, massage therapy, diet-based therapies, the use of all sorts of natural products, deep breathing exercises, meditation. All of these types and many, many more are being used more and more and more. And unfortunately, there isn't a lot of education in medical schools on the proper use of these therapies and or what they are. So it doesn't surprise me that your physician may have a negative opinion. Now, let's talk about the medical education for a minute, because isn't that where your doctors get their opinions from? I mean, where do we get our opinions from in life? We get it from what we know. So we come up with some opinion. Well, the status of nutrition education in medical schools was studied, and there was an article that appeared in the American Journal of Clinical Nutrition in 2006, in April, in fact. And this is the Journal of Nutrition. Now, according to this article, most graduate medical students rate their medical nutrition education as inadequate. The ultimate result of the study, which totaled over 106 surveys with a response rate of about 84%, that it's not only inadequate, but in terms of the average number of contact hours, the number of hours doctors get studying nutrition during their entirety of their medical education is only about 23.9%. 23.9% contact hours of nutrition in medical schools. Well, I don't know about you, but I exercise more hours than that in 3 weeks. So the problem is, if you are looking to your physician to give you a qualified opinion about nutrition, then you're looking in the wrong place. I mean, we wouldn't ask our dentist to give us a gynecological exam. That just doesn't make sense. Why would we ask our physicians to give us nutritional advice when they're not qualified to give it? But they seem to give it. But on the other hand, to be perfectly fair and honest, I'm deeply concerned about medical advice given by alternative healthcare providers on occasion. Now, of course, I'm generalizing in both of these areas right now. You need to look into your life and your experience and say, well, do I have these experiences with my physician or my alternative or holistic healthcare provider, or do I not? And if you do not, then it's a non-issue for you. But there are issues on both ends, and it comes down to you as an informed healthcare consumer to learn and know the difference. So I spoke earlier about how hospitals are starting to open up these holistic health centers as well. Now, how can doctors and hospitals offer these therapies when there's not the education in medical schools? Well, if you look at any nutrition health book, and usually they'll have a few pages on alternative medicine, you'll find that it's 2, 3, perhaps 4, maybe 6 pages long. It'll give you a definition of acupuncture and chiropractic and herbal therapies and Ayurveda and yoga and all that, and that is it. And hospitals are opening up these centers, and when they survey them and ask them why, they say because of public demand. So it is a demand-supply situation. So, as I mentioned, alternative healthcare providers are also guilty of, in my opinion, some of them, of giving advice in areas they should not, treating things that should and can be very easily managed medically. And on the other hand, there are medical physicians and medicine in general that is treating things that are very easily managed through natural medicine. So, given all of this, well, what is the best that medicine has to offer? Well, let's look at the facts. I think there are brilliant minds in medicine and in medical politics. But with all the designer medications, all of the advanced technologies, and the ability to find diseases earlier than later, we are now going to experience a reduction in life expectancy and diminished quality of life. Why? I think because we have an incorrect application of brain power and intelligence, a lack of vision, and a narrow-mindedness that exists and is pervasive in medicine. And I also think it exists and is pervasive in alternative medicine. Any system that excludes the other is a club I don't want to be in. That's why integrated medicine, to me, makes the most sense. Use what works in different areas, make it available, or at least know where to send people when it's appropriate, because it's not about me. It's not about the healthcare provider. It is about your health. So what is this business about life expectancy? Well, the New England Journal of Medicine predicts a decrease in life expectancy, which rose slowly but steadily over the last millennium. And to quote, it's distinctly possible that our children may live shorter lives than us. It's a frightening prospect. It will be the first time in the modern era that we actually see one generation experiencing a shorter lifespan. That's what we're seeing. Now, we're going to talk about exactly why this is after the break, so you baby boomers better hang out, not to mention the rest of you. I'll see you in just a minute.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
Get ready for increased passion, clarity, creativity, and growth in your life. Are you ready for the nurturing support of your angels and guides? From the divine, from the higher wisdom of the universe? Join Ann Deirdre Smith each week for Hear From Your Angels, and will offer free spot readings on the air. She'll answer questions regarding relationships, soul path, emotional well-being, any question you have. Listen for Hear From Your Angels with Ann Deirdre Smith, Thursdays at 1 p.m. Eastern Time, 10 a.m. Pacific Time on Seventh Wave Network. Are you frustrated with your doctor's lack of thoroughness investigating your health concerns? Are you surprised that they often say, your blood work is normal, and then give up investigating your health issues? Or worse, they offer you medications instead of answers. If this sounds familiar, then you should know about Dr. Michael Wald's Blood Detective technology. Send your blood and other test results to Blood Logic, and you'll receive a detailed report of all of your tests with a complete description of their potential meaning, both medically and nutritionally. Dietary and nutritional supplement advice is also included. Dr. Wald himself will personally provide you with his personal opinion of your test results if you request it. For more information about your Blood Logic report, go to www.blooddetective.com or call 914-666-2943. Start getting answers today. Again, visit blooddetective.com or call 914-666-2943.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You're listening to The Blood Detective, Finding Healing Solutions Naturally with Dr. Michael Wald. To be a part of today's discussion, please call in toll-free at 1-866-472-5792. That's 1-866-472-5792. Or send an email to info@intmedny.com. Speak up. Dr. Wald wants to hear your question. Now, back to The Blood Detective.
Welcome back, everyone. This is Dr. Michael Wald, and we're having I think, a very important discussion regarding alternative medicine entitled Attack on Alternative Medicine. I do not think that alternative medicine has all the answers, or holistic or natural or complementary medicine. I don't think that medicine has all the answers. Each of these methods of approaching people and maintaining health and reducing disease risk and treating disease practices within certain philosophical guidelines and therefore has different tools that they use, and each believes that what they offer is important, and I think there is validity to that on both sides. All I'm saying is that we shouldn't have a system that divides them up, and it saddens me that there's so much controversy among these two groups. But, you know, patients ask me all the time, they'll say, Dr. Wald, do you think that one day natural medicine, alternative medicine will be accepted by mainstream medicine? And I used to think that that'll never happen. But the question is much bigger than that. First of all, it's not my goal that alternative or natural medicine is accepted by mainstream medicine. Mainstream medicine is one way of healing. One also might say, how about this? Dr. Wald, do you think that alternative medicine will ever accept mainstream medicine? So that's really my view. It's not that the natural healthcare field is subservient to medicine, and it shouldn't be the other way around, but I am very certain that not only has the public embraced natural medicine. I read statistics at the beginning of the show that says the bottom line in medicine is deeply affected, and people want alternative medicine. They want natural medicine. That is the bottom line. So I also realize if you study the history of medical developments, in short, you cannot get paradigm shifts. You cannot have evolution in healthcare without conflicts. I think that's true of any relationship, and there's no difference between alternative medicine relationships and natural medicine relationships. So the conflicts are happening, and they're happening at a feverish pace. To me, that's a sure sign of acceptance, because after the storm, people are changed. Thinking is changed. And so there's no doubt in my mind that the planet is different and will always and forever be affected by what natural medicine has to offer. Not to mention, it was here first. Okay. So I said before the break that, medicine has contributed to, by its, I think, lack of attention, to a reduction in lifespan that's seeing right now for the first time in the modern era. We see that one generation will experience a shorter lifespan than the previous generation. And according to this research, the decline in life expectancy will occur in the first half of this century, and where life spans will shorten by 4 to 8 months on average. And in the coming decades, as obese children, carry their elevated risk of death and disease into older age, the average lifespans could fall by anywhere from 2 to 5 years. Among the baby boomer generation, diseases such as diabetes and heart disease, well, they're expected to hit around age 60 or 65 now, which is just horrific. Such a young age. But about 20% of the current generation of children are overweight or obese, or those with diseases that will manifest probably in them 5 to 10 years earlier. The number one growing disease in adolescents right now is diabetics, and this shortens life. So medicine is not focusing on the cause of most of the preventable causes of death in the United States. This is almost entirely the focus of alternative medicine. How can we say that's not worth studying? How can one say that's not worth exploring? Well, I don't know. I honestly do not know. When we talk about alternative medicine and medical doctors versus alternative medical practitioners, first of all, alternative medicine is not just medical doctors. It's medical doctors, it's osteopaths, it's chiropractors, it's nutritionists and acupuncturists and even whole pharmacists and nurses. We can go on, and forgive me for those of you I may have left out. But we're not just talking about medicine. I prefer to have a base in medicine, in laboratory testing for individualization of things and then choosing natural remedies, but that doesn't mean that's the only way you can get results. That's just what I prefer to do. But not all holistic practitioners do examinations, which are nutritionally oriented. And we're not saying at all that medical examinations are particularly useful either. Even the American Medical Association is thinking of doing away with the standard medical exam because unless you're having a heart attack during it, it doesn't seem to be of much value. So the point I just want to raise here is that there's different types of levels of practice of alternative medicine. And it will take some work on your part to determine, how deep a depth of knowledge you want your alternative practitioner to have. I had a patient recently that came in the office with health issues, and he was told that he just had some high cholesterol. That was pretty much it. He was here for a checkup. So we worked him up, and we found that he had extremely high cholesterol, enough that increased his risk of cardiovascular events to a severe level. He was a bit overweight. We discovered he had a real-life immunodeficiency disease, never before found, and not from a holistic perspective, a medical perspective. His vitamin D level, very low. The lower that is, the higher one's risk of all causes of death. We also found that his blood calcium level was high. That's no small thing. That could be from cancer. That could be from a parathyroid tumor. That could be a lab error. To make a long story short, this patient went to his doctor at a large medical group who was astounded and said, why did they perform all of these tests? I said to the patient, I understand that response because your doctor is a specialist in an area and they perform certain little pieces of tests in their area, et cetera, et cetera. The point is when we see a patient, we look at the whole patient. We don't divide the body up into artificial segments and then test those segments. That slows down medicine. It contributes to inadequate communication among healthcare providers, delayed treatments, and then at the end of the day, the treatments are not necessarily based on the causes of things. So I was astounded at this response, more on the patient's behalf, but feeling so good that we were able to find these things on this gentleman. So there's a big difference in terms of the paradigm, the way of thinking, and the approach that an alternative or a complementary or integrative practitioner has as opposed to a standard physician. I am actually quite astounded that many physicians in different areas of medicine are almost entirely ignorant of other areas of medicine. And they say, well, that's what we have people specializing for. Yeah, but the communication between these different specialists is just terrible. Look at your experience. If it's good, great. But a lot of us, from what I'm hearing, find it's not so great. Now, again, some of the reasons for these negative responses that people receive from their physicians when they find out their patients have dared to try something other than what they give, folks, I don't know. All I know is that people have personal insecurities and limited beliefs. I am, of course, a person with the same limitations, but we do not want to put our personal issues ahead of the welfare of the patient. We do not want to have an emotional response that gets our ego in an uproar and not have a rational response that may or may not be based on some science. So I think ignorance is an issue. You know, I hear a lot, too, I think every week, the patient will say, oh, the doctor says, well, if it works at all, it's all placebo. It's all placebo, which is like the sugar pill, you know. It's all in your mind. Well, you know, your head is attached to the rest of your body, folks. We learned that in Anatomy 101. So common sense should tell us that if you get a cure from anything, that's good. But let's look at the science. The New England Journal of Medicine did an analysis, clinical trials. They compared placebo to no treatment at all, and they concluded there's little evidence that suggests that placebo has powerful clinical effects most of the time. Another study, as I recall, mentioned that beyond about 36 days, all placebo effects are gone anyway. So if you're well after that, it's not placebo. So I think it comes down to this, in my view. We have bias in alternative medicine. We have bias in standard allopathic medicine. What is bias? It's this inclination, it's a temperament, it's an outlook. It is an unreasonable, prejudiced judgment, and that is disgusting because when on a daily basis, when I am sitting with people and it occurs to me that they have been limited and their health has been delayed because of the personal opinions of another, that's just sad. So we have uninformed practitioners on both ends of the health and disease care spectrum that feel threatened. Their bottom line is being reduced. That is a fact. I think that closed-minded individuals, whether they're medical physicians or alternative medical or alternative non-medical physicians or medical physicians, are victims of their own compartmentalized education and biases reinforced by the limitations of where they work. You know, if you're surrounded by like-minded people, you tend to make limited choices. And I think that's a problem. I think that is a huge problem. Now, some criticism also tends to focus, and I know you've heard this one, on there's no science. You know, there's no science to support the use of alternative or natural medicine. Well, let me start on this conversation. We'll complete it after the break, but there's what's called science-based medicine. This is what medicine is based on, science-based medicine. This is a method. It's a philosophy, a way of thinking that allows for a certain approach to people. And likewise, integrated medicine or holistic medicine is also a thought process. It's a certain logic, and that'll dictate what the healthcare practitioner does as well. So I think that using both is great. Why just one or the other? But medicine tends to rely almost solely on science and scientific studies. So after the break, I'm going to go into a discussion of what's unscientific about scientific studies. We'll talk about the evidence-based medicine approach. Then I'm going to talk about death in the United States one more time because that's the reality of all this. So please send those emails in, and we'll see you in a few minutes.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
If you have a loved one that is undergoing treatment for substance abuse or mental illness, you owe it to them and yourself to tune in to 1 Hour at a Time with host Mary Woods. This compassionate and educational talk show will help you help those that you love by better understanding their condition and their personal recovery process. Tune in every Monday at 12 noon Pacific Time to 1 Hour at a Time on the Voice America Health and Wellness channel. Recovery begins this hour.
Are you frustrated with your doctor's lack of thoroughness investigating your health concerns? Are you surprised that they often say, your blood work is normal, and then give up investigating your health issues? Or worse, they offer you medications instead of answers. If this sounds familiar, then you should know about Dr. Michael Wald's Blood Detective technology. Send your blood and other test results to BloodLogic, and you'll receive a detailed report of all of your tests with a complete description of their potential meaning, both medically and nutritionally. Dietary and nutritional supplement advice is also included. Dr. Wald himself will personally provide you with his personal opinion of your test results if you request it. For more information about your BloodLogic report, go to www.blooddetective.com or call 914-666-2943. Start getting answers today. Again, visit blooddetective.com or call 914-666-2943.
While parenting has its joys, it's also stressful. If you'd like help finding practical solutions to the challenges you're facing, listen to Real Parents, Real Solutions with host Tony Shuda. You'll leave with options you can try with your kids right after the broadcast. Tony will interview experts and real parents for real solutions to problems that will reduce your stress and make your family happier. Call in, write in. This show is for you. Real Parents, Real Solutions airs Wednesdays at 1 p.m. Eastern, 10 a.m. Pacific on the Voice America Variety Channel.
You're listening to The Blood Detective, Finding Healing Solutions Naturally with Dr. Michael Wald. To be a part of today's discussion, please call in toll-free at 1-866-472-5792. That's 1-866-472-5792. Or send an email to info@intmedny.com. Speak up. Dr. Wald wants to hear your question. Now, back to The Blood Detective.
Welcome back, everyone. This is Dr. Michael Wald, and we're continuing our discussion on attack on alternative medicine. I'm trying to make a case here for you to then be able to internalize and make better healthcare choices to navigate more effectively throughout the course of your life, because you will be exposed to illness and dysfunction, and if you miss the opportunity to most ideally manage yourself, then it could literally cost you your life, or certainly the quality of your life. Before the break, I started talking about science-based medicine and the scientific method, which is the fundamental criteria used by physicians, at least philosophically speaking, where they sort of base their opinions on. And that science is good. And there are many positive aspects of the scientific method, which basically means scientific studies. So studies are important. You know, you take a group of people and you study the effects of this drug or this therapy or this nutrient on them, and then you draw a conclusion. Now, sometimes, though, science is not so convenient. We may have a study that says that a certain amount of a drug or a certain amount of a nutrient may be what is required for a person with this condition or that condition. But, you know, a person may have many conditions, and they may respond very, very individually. Isn't this common sense? We all know this, I think, fundamentally. And, therefore, there may not be an exact study. I've actually had doctors tell patients that there are no studies to support the use of vitamin E in heart disease or vitamin C intravenously in cancer. First of all, these are untruths. But the point I'm trying to make is that scientific studies are very useful. I certainly pride myself on continually researching issues on behalf of my patients. But a good practitioner uses scientific studies as to inform them, not to dictate to them exactly how to treat people. Scientific studies, this is important, folks, are based on average people. The average 70-kilogram man, in most cases, doesn't exist. You have to take a person, know what the studies say in general, and say, okay, what applies to this person? And let me do some individual testing that spans many aspects of medicine as quickly and as accurately and as painlessly and as cheaply as possible, and figure out the safest solution possible, the one that will do the least to no harm. But that is not how medicine works. I have found through relating to patients that doctors simply don't know about all of the evidence that there is to support the use of natural medicine. But be that as it may, scientific studies are usually full of problems. We could have a whole weekend symposium on the problems with scientific studies and their issues. But I will just leave you with recognizing that even medicine itself is realizing that scientific studies, including the gold standard of evaluating something called a double-blind, placebo-controlled study, is under scrutiny as being unrealistic and inaccurate. Not in every case. So I'm not mentioning throwing out the baby with the bathwater. But be that as it may, we use science as a benchmark, but not as a dictating aspect of health care. Now, in medicine, they talk about evidence-based medicine. Everything needs to be based on evidence, which, of course, is based on scientific studies. So in evidence-based medicine, they take a bunch of medical studies, which could be not so great and not necessarily agreeing, and they put them all together in some statistical crunching of the numbers and decide what makes the most sense. Well, that's okay, I guess, but why don't we just take one person, look at their issues, test them, describe a natural therapy or prescribe it, retest them, and see what happens. That's not going to happen in a scientific study. The individual is ignored in scientific studies. It's about averages by definition, so it is quite limited. I can tell you one thing: my mother is no statistic, and neither is yours or your kids or your family or yourself. So look, let's get back to reality here. So of the 783,936 annual deaths due to conventional medical mistakes, approximately 1,000 of them are from prescription drugs due to death by medicine. And that's probably a very conservative effort. But I think that's partially caused because people insist on the medications and doctors give it to them, et cetera, et cetera. So people need to be re-educated. There is no doubt. So why do people then choose natural medicine? Well, I think they're disenchanted, as I said earlier, with medicine. They're discouraged because medicine is disorganized. There doesn't seem to be a quarterback. People have said that to me. There's no quarterback. No one knows kind of a little bit about everything that's happening. People are rushed. They have criticized that medicine is too money-focused. The treatments are too toxic. And that their doctors are just not listening. Let's move on for a moment before the show ends about medications for a moment. Well, we hear doctors criticizing nutrients, but, pharmaceutical drugs, there are also problems there too. Did you see the New York Times article which talks about the fact that there is a poison that was made its way from China and India into a lot of American-made drugs because in the next few years, upwards of 80% of our medications will be from China, which was laced with diethyl glycol, which basically is antifreeze, which killed many children and killed tens of thousands of people, and also in the United States. And let me tell you, that's just the numbers we know of. I am predicting that as wonderful as our physicians might be at diagnosing, many of these illnesses which result from impurities such as heparin or heparin derivatives or this antifreeze issue, which again appeared in the New York Times in their studies called Chinese Chemical Flow Unchecked onto world drug market and from China to Panama. A trail of poisoned medicine shows that there are lots of problems with medications, and many of these medications are found to be counterfeit. These are medications given to people with cancer and Alzheimer's disease and diabetes, and then we're giving these people medications in studies and trying to make sense of statistics and studies. It is a mess. So look, at the end of the day, I think what we need to consider is that medicine is part of the solution, but it's up to you as the individual to educate yourselves, interview your doctors, call the office up. Can I speak with the doctor? If they say no, then keep calling until you can. In alternative medicine, it's much easier to sit down with a practitioner. They give you the time. We want to know in my office if you're the right fit for us. We speak with you before you become a patient. I mean, in that way, we can determine if we're the right offers for you, and you determine if, the vice versa, if that's true as well. I should make mention of medical errors for a minute. Medical errors, according to the American Medical Association, cause 2,000 deaths a year from unnecessary surgery, 7,000 deaths from medical errors in hospitals, 20,000 deaths from other errors in hospitals, 80,000 deaths from infections acquired in hospitals, 106,000 deaths from non-era adverse effects of medications, totaling up to 225,000 a year in the United States. Medicine has no right, in my opinion, to take the superior stand when it is so far more dangerous, even when practiced correctly to the letter, than is alternative medicine. I do think that there must be needs to be a meeting of minds. I'll leave you with one last thing. I hear a criticism often. Patients will say, my doctor said that nutrients are not FDA approved. Well, that's right, because the FDA doesn't approve nutrients. They approve drugs. But according to a USA Today article in 2000, more than half the experts hired to advise the government on the safety and the effectiveness of medications have financial relationships with the pharmaceutical companies. So these experts advise the FDA on what medications should be approved. Now, federal law is supposed to prohibit the FDA from using experts with financial interests, according to this USA Today article. But the FDA waived that restriction more than 800 times since 1998. So, folks, I think you realize that this is up to us. What I would say to you is educate yourself first on your health issues. Speak to your healthcare providers. Being well informed, test them out. See if they know what you know. See if they teach you something. If they do, they're probably the right practitioner. Get a referral. So I want to thank you very much for listening to today's show. I want to remind you that all of the Blood Detective shows are archived, and for future shows, that you'll want to look them up on our website, on our homepage at www.intmed.com. That's INTMED, NewYork.com, or call us at 914-242-8844. This is Dr. Michael Wald, host of your Blood Detective, and we'll see you next week for improving longevity and quality of life. Take care. I'm going to have a great day.
Thank you for joining us this week on The Blood Detective, finding healing solutions naturally. Please join Dr. Michael Wald again next Monday and every Monday morning at 7 a.m. Pacific Time, 10 a.m. Eastern Time on the Voice America Health and Wellness Channel. Here's to another healthy week for you.
Thanks again for listening to the preceding program, brought to you on the Voice America Health and Wellness Channel. For more information about our network and to check out additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the preceding program are strictly those of the hosts or guests and do not necessarily reflect the views and ideas held by Voice America Talk Radio Network, its staff, and management.